Just stop it. The run-of-the-mill, cheesy, humdrum bullshit status quo just tires me out. What fascinates me are the industry disruptors, the superhuman frontiersmen or women who go through hell to achieve their goals. Join me as we meet and learn from those mavericks, rebels, and business leaders that aren't afraid to piss off the establishment in order to make radical change for good. Sponsored by Johto PR, the disruptive anti-PR firm that murders your competition with cinder blocks and cyanide. This is Disruption Interruption. Welcome back, everybody, to Disruption Interruption. I'm your host, KJ, and we're here today to talk to another industry leader that has steered off the lame, tired path of the status quo. Let's talk about a dirty little secret in the UK healthcare world. We have some of the most brilliant medical minds on the planet, but we're treating them like amateur office managers. If you're a private consultant today, you're likely spending 40% of your time fighting with archaic billing systems, chasing patient emails, and trying to figure out marketing while you're supposed to be saving lives. Honestly, it's a load of rubbish. We've professionalized everything else in our lives. We can book a trip across the world in 3 clicks. But if you want to see a specialist, you're suddenly back in 1995, waiting for a call back from a fragmented one-man band or small team. It's bad for the doctor, it's frustrating for the patient, and it's a massive bottleneck for the entire industry. Well, our guest today is here to tell the medical establishment that the lone wolf model is dead. He and his company and founder are disrupting the status quo of inefficiency. They're proving that when you apply total practice management mindset, doctors grow their practices by 50%, and patients actually get the care they need without the administrative headache. They're turning private healthcare from a fragmented mess into a world-class journey. Please welcome to the show the CEO of Medmin, Andrew Archibald.
Way so much. What an intro.
What an amazing intro. We have amazing guests.
Very impressive.
You are impressive. What you guys are doing impressive. Let me ask you something, Andrew, before we get going, because we talk about this a lot, of course, in the U.S. healthcare scheme debacle, whatever you want to call it. It's very interesting to find out what's happening across the pond, right?
Yeah.
But for you and your team, your founder, you're innovating and disrupting an industry, right? For you personally, what's led you towards those kind of roles, those innovative, disruptively innovative roles?
Wow, there's a question. I'm just really, really curious. It is the ultimate thing. And I always want to unpick things and find out how they work. So I just love solving problems. That's it, really. So, I mean, all my career, I've done change roles because I always gravitate towards of how do you make that work? Or why is that not working like that? And surely there's a better way of doing it. So that's what I love. I love that in the morning. That's why it gets me out of bed. I've done roles that have been a bit more, prosaic, where it's about just managing and keeping a steady state going, and I find that really boring. I'm in governance meetings and I'm nodding off and I'm doodling and I'm not. So I think I realized, know yourself is the most important thing, and I love trying to solve problems. That's what I love.
It's awesome. It's really awesome. Do you know that we have to do a poll? We've done well over a couple hundred episodes now, but curiosity is one of the common denominators of all of our guests. Real curiosity. Why, how, and how can this be better?
Yeah, wow, I can understand that. I think I'm pretty just one of those people who, once I get into a new topic, I buy all the books, I read all the podcasts, I consume everything because I just want to know all about it and just get it into my brain.
That's fantastic. Okay, great. Well, then we are going to pick your brain today on this particular issue, the status quo in the UK healthcare scene.
Yeah.
So please educate our audience. Like, what is the landscape now like in the UK healthcare scene in this sector?
Yes,
Truly,
okay,
the good, the bad,
point.
the ugly.
Yes. So I'll probably a little bit of context for everybody because not everyone will be familiar with it. But so we operate in the private healthcare market in the UK. As people probably do, if they don't know anything about the UK, they know we have a national health system. So the NHS, state funded, provides the overwhelming majority of everybody's care, but not everything. So, the NHS struggles sometimes with waiting times. the way that care sometimes get rationed because there are limited resources in any system is through making people wait. And in some areas, some specialties, that wait can be much longer than people want to accept. Obviously, you've still got, even now, the impact of COVID that's lingering in the system because all those backlogs that built up are still there. So the waiting lists in the UK doubled during COVID, and now while they've stabilised, they haven't really started to come down. They've come down by small amounts, so there's still lots of people who are waiting, sometimes over 18 months for surgery.
Before you go on, just hold that thought there. I'm so curious. So, I mean, COVID's what started in 2020, right? And now we're in
Yeah.
2026, and you're talking about COVID backlogs still there. Like, give me like a give me a better perspective. I don't understand this.
Well, I mean, in fact, what happened, I suppose the backlog before that is because the NHS is funded by the state, when the British economy does well, the funding is good. When the British economy is doing less well, and after the financial crash, it was doing less well through the 2010s. Therefore, it didn't get the same level of investment. So it was starting to creak away.
Oh, I get it.
What happened effectively was it was running relatively threadbare. It hadn't been the capital investment, but was just about holding on. And COVID came along and absolutely floored it.
Just decimated it.
Decimated it. And probably with hindsight, policymakers would say that we shut down too much. So all of a
Mm.
sudden, no operations were happening, no care was happening for the majority of people for a year. So that's why waiting lists absolutely ballooned. And I think it just took the service a long time to get back on its feet.
So it's still taking a long time to back
Still
now.
not there. It's still struggling now, and it varies by different areas of the country. It's not a universal picture.
Right,
But what that means, and I guess that's relevant for, what I do and what we do, is that private healthcare fills that gap or that niche
right.
next to the NHS. So the NHS is there and provides, 95% of what people need. But there are certain things you won't get treated on the NHS. They just, for whatever reason, they don't do it, or you are likely to wait a very long time in order to get it.
So give
And
me an example
so,
of some of the specialties that either the NHS doesn't support or you can't wait long.
yeah. So obviously, so you can wait, over 12 months, 18 months for a hip replacement in some areas of the country.
Wow.
People who have had a hip replacement, and thank God I haven't, will know how painful that is,
Yeah, totally.
and how much it can ruin your life. And, there's lots of examples like that. So I think, or there's things like, for example, and again, it's a much simpler procedure, but in some areas, if you've got a very simple hernia, the NHS actually won't do the surgery because they'll say it's not that bad. Clinically, you don't need the surgery. You can have it managed. And so because that's the cheaper option, that's what they'll do.
Right. But if you're a very active person, that's not workable when you have a
Yeah,
hernia.
so for lots
Not.
of people, they don't
Yeah.
care. They're like, and I just want it fixed. Or take prostate cancer. So actually, something lots of men will have prostate cancer, but they'll live with it. It's not going to kill them because it
Right.
happens, particularly with older men. And clinically, they'll say, well, we don't need to treat it. We don't need to remove it because it's so small. It's not really a problem.
Wow.
But obviously, some people go, I don't care. I just want it out.
Yeah,
And
totally.
so it's those kind of things where they'll particularly turn to the private healthcare system. So it's for choice, it's for speed, and it's for those, in the grand scheme of things, small areas, but those particular treatments that for whatever reason you can't get on the NHS.
I don't know if you have an answer to this or if it's even easily answered, but what percentage of of the healthcare system, are these like this private sector? 20%, 10%? Do we even know?
We do. I should know that stat, shouldn't I? I'd be like, oh my God, why is that not there?
Sometimes I know. Sometimes I ask questions and it's like not even possible to know that data, right? But
We do. I would say, oh God, it's probably about 10%, say. Someone will tell me and say, Andrew, how did you get that wrong? It's, it's
anyway,
and
but
it's,
it for
yeah.
for okay, let's just say it's 10%. Let's say it's 5% for I mean the entire UK. That's a significant amount.
Yeah, it's huge. So I mean, as an industry, the private healthcare is worth 13 billion pounds. So in terms of value, you've got 13,000 specialists who do it on a regular basis. So it's some big numbers there and lots of people. And I think, oh, I should know, you're treating about 1 million people a year, if I remember rightly. I should go and get my stats out. individual
The private
patient.
sector.
Yeah,
Yes.
private sector. So,
1 million people
it's
a
six,
year. Wow.
it's big numbers and a big value as well.
Huge. Yes. So we have this wait list. We have, these specialties. And so where's this inefficiency? What's this bottleneck? What's
What's
happening?
happening? Yeah,
Yeah.
exactly. So I think what happens, the way the private system in the health in the NHS, sorry, in the UK works is because everyone works in the NHS. So all the hospital specialists will work in the NHS, but they
Oh,
have the flexibility to also work in the private sector.
not know
So
that.
the majority of, secondary care doctors will, and they once you become a consultant, so I don't know what you might call it in the US, but that's basically the top role. So when you're the
That's what you call it
consultant,
in the US. Okay. Yeah.
it's consultant as well, is it?
Obviously
So
that was in the
once you
intro,
become a
consultant.
consultant,
But that's what it
you
is.
can then do private practice and you have the flexibility. So typically, most of them will work 4 days a week in the NHS and then do 1 day a week private. And then over time, that might increase to 2 days, but they still do both. Until maybe either you love it so much, or you get towards later in your career and you wind down your NHS work and you just focus on your private practice. But
Mm.
obviously, so there you are working in the NHS, everything's provided for you, complete management systems, etc. When you step into the private sector, you're effectively a sole trader. You are on your own and you have to provide all your own admin, all your own IT systems, etc., etc., etc.
Hiring, everything.
Hiring people, and because the private hospital groups in the UK don't want to employ them. And there's, like I say, because of the NHS, that's the model that's evolved, so that you don't employ private doctors in private hospitals because they already have a main contract already elsewhere, and it would add more cost. So it's much more efficient for the private hospitals just to have them as visiting specialists effectively.
Mm.
You take space, so they take a consulting room, they rent the theatre space. So the private hospitals will provide the nursing team and the equipment and those kind of things. But you as a doctor have to provide everything else.
And we all know that doctors, it's not something that they have been educated or trained in, right? And
Exactly.
it's
Yeah.
the same thing in the US. It's like they go to school for chiropractic or to be a DO or an MD or whatever, and they are not trained in business management.
Exactly. And it's a
Yeah.
whole different skill, isn't it? And it takes time to learn, and even if you don't do it, it's the context switching, isn't it? So all of a sudden, these incredible, capable people who have been trained to do certain operations in their specialism better than everybody else are expected to deal with, relative terms, really mundane tasks. Of
Mm.
you've got to make sure this billing code's right, and the insurer won't authorize it unless it's got this code on it, which is like, oh my God, what's here? And I'm expected to know what health record I should buy and use to make sure everything's safe. So yeah, it's a complete nightmare for them. And then, for whatever reason, traditionally, what would happen was they would use lots of fragmented services because obviously, they're working on their own or they might be working with a couple of partners. They don't have the time or necessarily the infrastructure to afford all those overheads that make all those things run smoothly. So they would often, they'll get someone just to do their note taking for them. They'll have an accountant to do things around their billing. They might use a billing agency for this, someone else for their healthcare record. So lots of these fragmented things at relatively small cost, but incredibly time consuming for them. So even now,
Not
I
every
talk,
one of them talks to each other, and then, maybe an
yeah,
API or you have plug-in purgatory or whatever, and they're not IT specialists. Am I right?
exactly. Yeah, yeah,
Okay.
all of those things. And so I mean, I still, even now, I talk to doctors who tell me on a Sunday morning they're going through and writing their invoices.
Damn.
These people work so hard and they're so fantastic and make a massive difference to people every day. And instead of the Sunday enjoying time with their family or at least having a well-earned coffee, they're trying to work out where's my billing and my notes and stuff, and it's crazy. So we're just there to take all that pain away. I always say, in some respects, what we do is not really sexy, but we put all of those things together. So Simon, our founder, and he's been in private practice for 20 or 30 years. And he had who's now our chief commercial officer, Julie. they got together, and Julie started out as his medical PA and was doing his notes. And then because she's curious and enterprising like I am, she was like, why are you handing that off there? Just give it to me. And why are you doing that? No, just give it to me. I'll do that. And before you knew it, she was running everything. She just connected all of these different services that he needed, and she was doing it in one. And then his colleagues started to go, ooh, could Julie help me as well? Could she look after me? And I think it was at that point they both went, ooh, we've got a
The
business here.
light bulb went off, right?
We've got a business. And so I've come in, I've been here now about just a year. And I've come in to help scale because we've sort of based in Birmingham. We've organically over a sort of 3 or 4 years, we've got about 40 doctors. And I've come in to say, how do we take this across the UK? How do we go and bring this solution to everybody? And what's fascinating for me, and I think it's really interesting, is, you'd think, Andrew, this is not necessarily a super new idea. It's been done in other industries. Why is it not applied here? But I think it's just been so fragmented. And like you say, because doctors don't have that understanding about business and business administration, they've not had the knowledge about how to build a company. And when you've had people like medical PAs who have done it for doctors as their business, they've very much been, hand to mouth's the wrong word to describe it, but it's subsistence business. They earn a
Yeah.
wage from it, but they're not building a business. They don't know how to scale it, or they hit the limits of their capacity or their knowledge, and they don't know how to take it further. So what we're doing, I guess, is ultimately, is we're bringing some capital in. So Simon, through his contacts and various kind of small investors in the Birmingham area, we've been able to get some money in. We've been able to bring in a great CTO, a guy called Warwick, who just knows how technology works. So I think all of a sudden we've been able to assemble a team that can solve those problems and scale in a way that other people haven't previously been able to do it. So that's the goal, and that's why I'm here, and I love it. It's so much fun.
That's so great. And I love talking about this in the UK because obviously this has been, just as comparative. And sometimes people understand things better by comparing it to things that they
Yeah.
know. In the US, this has been a known problem and issue for decades, right? Of course, we don't have the NHS, right? And so, I'm curious, like, this is, it almost seems a bit newer, this type of technology and what you're doing in the UK. And even probably newer recognized as a problem. Am I correct about that or incorrect?
I think people have probably, I mean, certainly the consultants have known it's a problem,
Yeah.
but I think they've just lived with it. So,
Probably because of just the percentage of the healthcare that they're dealing with in the UK
yes,
compared to America, right?
exactly.
Even though
And
it's
I
a
also,
huge number.
yeah, yeah. And do you know what? Certainly, my own personal perspective is healthcare in the UK, because there's all the challenges of the state-funded model. You're always dealing with scarcity. And so people have just learned to put up with inadequate systems. The healthcare system in the UK is very poor at investing in technology, in the administrative things that make the whole thing get better. And so, yeah, people have just got used to poor systems and poor services, and they kind of accept it.
Yeah.
Yeah, and it's about time to say
And
stop
your founder
accepting
said,
it.
that's it. I'm not doing anything. I'm done with this. That's
Exactly. Why am I spending my Sunday morning looking through my billing and invoices?
like, that's it. This has got to change.
Yeah, yeah.
I love that. So tell me what you guys have been able to do. I mean, we have, improving practices, efficiency, and, being able to scale and increase by, certain percentages. Give us some success stories.
Okay, so what, for individual doctors or for just we as a
You
level?
pick. Let's just pick. Let's go the
Okay.
gamut. Start.
Okay, so well, I guess what success stories because we bring all this together. So we've certainly found so one of our most likely or easy customers, if you like, is someone who comes into private practice for the first time. So they decided to make that leap, and they're like, "Oh my God, I don't know what to do. Where do I start?
Yeah, right.
How does this? What do you mean I've got to have all these things?" So we just handhold them through the whole process. So, because they have to get registered with the insurers, and we go, this is how you do it. These are the forms.
Oh my
They have
gosh.
to get what we call practicing privileges from the hospitals, but basically permission to practice. We know how all those works. We know what the format needs to be. So we just go, you give it all to us. We put it all together. We help package it. And then we kind of give it back to them and say, just send this in, let's send this over here. And because we've got the relationships with the local hospitals, we know the people to talk to. We help oil the wheels. So we're able to say, look, this is coming along, give the context. This is why the person's come into private practice, or we know where some hospitals have a gap versus others. So we do lots of advice to say, why don't you start here? Because, not unsurprisingly, often the doctor will go, well, I want to go to the most prestigious hospital in the local area and start there. That's not always possible. So,
Yeah.
but we have view of the whole market. We know the situation for all the hospitals in each region. And so we go, why don't you start here? This is a really smart place. We know that they're short of these specialists here, or we can see that this particular type of thing is really growing. So we help direct them, we help them get up and running. We effectively subsidize a doctor who's new to private practice for their first 2 years, certainly for their first year, maybe two. So
Incredible.
when they sign up, we provide all their systems for them. So their patient record system. There's something you might have heard of it, Doctify, but basically there's a patient review service. So it just
What is
works
it
like triple.
called?
It's called
Like,
Doctify.
what is
Yeah,
it?
it's in the kind of UK, Europe, and the Middle East. I don't think it's over in the US. Worth it checking out, folks. But basically, it's like TripAdvisor for healthcare. We provide that
Wow.
for free.
That's
So,
cool.
because like I say, you start and you have doctors having to fork out lots of money. So by signing up to us, we provide all that for them. So effectively, we provide thousands of pounds worth of service for free, plus advice in that first 12, 18 months as they start to get their patients and ramp up. And we also kind of offer a marketing service. We help write their profiles. We'll make sure that, so, on the directories at the hospital and the insurers, that they look their best. It kind of stands out to patients. And like I say, because we offer these free, we pay for their patient review service. That also makes a huge difference because, patient reviews, if you've got good patient reviews, you're more likely to get chosen. So
Of
it becomes
course.
kind of
Of course.
self-reinforcing circle. Generally, when we were looking at our data earlier in the year to inform some of our business planning, and new to practice consultants basically have a 300% growth in their earnings. And that's not
Wow.
from naught, that's from after their first 12 months. So from the end of year one to the end of year three, they'll increase their earnings by about 300%. So that's a
Incredible.
real difference we make to them.
That's lovely. Now you mentioned you do this for free, but you must charge for this.
Yeah. Well, we,
Yeah.
we obviously charge for them. I think what happens is it's kind of free up front, isn't it? So our model is that we take a percentage of their earnings.
Got it.
Exactly. So it's a
100%.
genuine partnership. We want to make them successful. If they don't earn, we don't earn. So and the great thing about that is, if they decide to take a month off or take a break or they go off to do a research project, we're not charging them, but we're still there providing those systems to them. But so we're absolutely invested in making them successful.
Wow.
And then for more established consultants, who already have a practice, apart from we just all of a sudden reduce their stress levels because all these things they've been struggling with, we just take away. But we've got a really good view of the market. We understand the right rates to charge. So again, I think there's a culture in the UK, and because perhaps the NHS, where people are embarrassed about talking about money. You never talk about money most of the time in healthcare. And so people are shy about charging their true worth, and they often will undercharge what they can do. So again, we've got that view of the market. We can bring that pricing expertise. And, we're not here to overcharge. We're not here to rip people off, but we are here to make sure the doctors get the right pay for their expertise and knowledge. Again, we take established consultants and we usually improve their income, even if because we're able to really improve their pricing structure to make it make sense. So works for them.
It makes them better doctors. I
Exactly.
mean, if you're being compensated fairly
Yeah,
for
yeah. And they're not
your
having to
worth and
worry
what
about
you're
it.
doing, and you don't have to worry about all of the practice management stuff. I mean, they
Stress
still have to
time.
control the area or, the technology or whatever and work with you guys. But the trickle down
Yeah,
effect is huge for the patients
absolutely.
and the
Yeah.
healthcare of the country.
Yeah, it is.
No, truly.
And that's, the true heroes really of the business are kind of the PA team because they probably spend more time talking to the patients through their journey and their treatment journey than anyone else because all those queries that and from the where do I park, how do I get where should I be in this hospital to the what happens next or well, I don't understand this. They act as so not only are they doing the jobs for the doctor and making sure that the notes are correct and the scan results are in the right place so they can review. They're talking to the patients all the time. They're addressing their concerns and anxieties. They're preparing them for the next visit. What's going to happen next? And just giving all those little insider tips that is never in the paper.
Never. You know, it's so very interesting that you talk about that. I keep like having like the pennies drop. In America, the nurses are that for the
Yeah.
physicians. And that, you know, I don't know if you, institutional knowledge, the care, the this, the that, the support that they do, and being the liaison between the patient and the physician and all of that care, they're highly, highly respected as opinion
Yeah.
leaders in our medical system. It's just like PAs in yours, and
Yeah, exactly.
it's a vast amount of knowledge that I think is incredible. I'm really glad you're bottling it up.
Thank you. Yeah. And yeah, because it's good. I think in the NHS, the nurses play that role similar to in America, but because of the nature of the way private practice works, yeah, it's probably the PA does a lot more of
Hmm.
that in the private sector over here, which is an interesting dynamic. But yeah, it's the knowledge that's in their heads. And I always think of them as there's one of the Indian gods that's got multiple hands. I always forget their name, but they are like,
Vishnu, is it Vishnu?
yes, that's
Yes.
it. They are like these ninjas just knitting all these systems together. We work across multiple hospital groups. So each hospital group is a different system, different notes, all the rest of it. So we're working across, we worked out they work across about 15, 16 different systems. And they are just these ninjas that knit that all together so that for the doctor and for the patient, it's as seamless as it can be.
That's incredible.
And
What are
that
MedMin's goals? What's your purpose? What do you want to accomplish? What do you want to do for the world?
I mean, our purpose, our goal is to make private practice as enjoyable and as easy and as stress-free for doctors as we can. So that's,
Uh,
that's number one. We just want to help these guys and girls be the best clinicians they can be, and we take all that away, and that they earn, yeah, they get a good income that represents their value and worth. The second bit, and this fits in really nicely, is actually on the patient side. We want patients to have really good choice and find the right specialist for them. Because the first thing doctors say to us is like, oh my God, just take all this away.
yeah.
But the second thing they say to us is, I need to find patients. Help me find patients. So
And they
again,
want to
part
spend
of what
time
we
with their
do
patients and they want to care
is
for their
is a lot of that promotion. And so we spend a lot of time really understanding what patients want. And again, people aren't in the UK, you're not really used to making these decisions because you go into the NHS and it all gets allocated to you and there's no real choice, in honesty. The private sector, you've got to make all these decisions you don't normally make. And so we act as their guides as well. So, who's the right specialist for me? How can I afford this? And what are my payment and insurance options? And how does it all work together? Actually, what's the right information I should look? So, yes, having the patient reviews is really helpful because it gives me a sense of what others have experienced.
good.
But actually, what are some of the clinical data I should go and look at? Tells me, patient reviews is one element. It's not all the other. And there's lots of information out there, but it's not easy to find. So I, as someone who, has worked in healthcare for 20 plus years, I know where to find it, but that's because I work in the industry and it's even not easy for me to find. So what we're trying to do is create those resources and tools that make it really simple for patients to make those choices against clinical factors as well as some of the other things like price and experience. So yeah, we're there to do that for patients as well. And what we want to do is create a brand that is UK wide. And I often describe it as being like Airbnb in healthcare, because Airbnb, whether you're a renter or a seller, that they'll serve you and they'll do both. So we want to create a brand where people go, whether I want to find a specialist or whether I'm finding patients, these guys are the people for me. And that we serve both and bring them both together in hopefully harmony.
I think you have to do that in order to have a good product for the physicians.
Yeah.
You have
Yeah.
to merge both sides. Oh, I think this is great. I love hearing about this in the UK. Okay, so just random question. What do you do? Like, what are your favorite hobbies? What do you do in your copious free time?
What are my hobbies? Well, I suppose I should talk about my latest addiction, which is
Okay.
all my wife's fault. So for Christmas, she bought me a sourdough baking course.
The best.
So off I went, learned how to make sourdough bread, which is actually quite easy, but it's so much fun. So Now I get up about an hour earlier. So, because I don't live that close to Birmingham, so it can take me about 90 minutes to travel in. So I now get up at 5 o'clock in the morning in order to have time to bake my bread before I come to work.
Amazing. I bet the house smells awesome. Is she
Um,
sorry that she's done that yet?
no, I don't. Well, not yet. I think she's actually
Okay.
become demanding. So what happens now is the children, or they go, "There's no fresh bread, Dad."
Oh
You get,
man, what are you
and
doing? You're slacking on the
oh
job.
my God, what's going on? So I have to. What I have to do on the weekend, I have to try and batch as much as I can. So it's in the freezer for the week.
Okay, in 6 months, I want to see how it's going. Okay, awesome. All right, so tell our listeners how to find you and how to find Medmin.
Oh, right. Oh, there you go. Well, it's very simple. It's just medmin.co.uk. And there you go, and you'll find us. And if you want to see our patient platform, look for getwellsoon.co.uk. So that's kind of our sister brand. Like I say, eventually we're going to bring them both together. So that's one of the things I've instigated, but we're not quite ready to do that yet. So we'll have one brand. But for now, so for the consultant services, go to medmin.co.uk and getwellsoon.co.uk for the patient platform.
Fantastic. And if anyone wants to reach out to you, they can reach out to you on LinkedIn and talk to you.
Absolutely. You will find me on LinkedIn. Send me a message. I'm always happy to get people from different parts of the world.
Great. Yeah. Thank you very much for educating us on this and what's
Thank
happening
you.
in the UK. I have a much bigger and better picture now and understanding of this. And my hat's off to you guys for doing
And
what
thank you very much. And thank you for asking about us and learn a bit more.
Of course. And then before we end off today, what is food for thought you'd love to leave our listeners?
Oh, food for thought. Here's a question. I mean, I should probably just talk what we're all of us at the moment are absolutely mainlining every single token we can with Claude. So it's not this is not a novel answer, and I'm sure lots of people are doing it. But if you are not spending time using it doesn't have to be Claude, it's not the only one, but using the tools that are out there to understand how that can just make everything in your business simpler and faster, then you are missing a trick. Even for me, I don't know code, none of us do, none of us particularly techie, but we are suddenly taking out chunks of time by just utilizing these amazing new tools. And it's one of the things actually as we're scaling, it's one of the things that's going to allow us to scale. So we haven't really talked about it so much, but we are looking at how we create like a med PA agent that can
Hmm.
start to do so much more of those tasks, and it's developing, and we're in the process of doing that. So hopefully come the end of this year there will be a Medmin PA agent that really takes the next level in terms of this kind of stuff. If you are not
Perfect.
spending time, so the best thing I did this year was I booked myself on a course. I really got my head around not just prompts, but develop, creating skills, all that kind of stuff. It is transformative. Invest in it, people.
That's fantastic. And that's a very good thing to end off on, especially because we're on disruption interruption, right? Yeah.
Definitely.
All right,
Brilliant.
guys, it's a wrap. Say hi and bye to Andrew. Andrew, thank you very much. Guys, thanks for listening to Disruption Interruption, where we transform lives, we change the healthcare system, we alter economics, and we never accept the status quo. Ciao for now.
Because we live in a highly litigious society, with America being one of the top litigious countries in the world, here's our legal disclaimer. This information is not intended to be a substitute for professional public relations or legal advice. Do not disregard seeking professional, legal, healthcare, or financial advice, or delay seeking professional PR or legal advice because of something you have heard here. Contact an attorney to obtain advice on any particular legal situation or problem. Use of this podcast or our website or any of its social media or email links do not create an agency-client relationship between Johto PR and the user.